Thank you so much for coming to our IC. In this talk, I'll be talking about how to direct an ophthalmic movie for film festival and Premier League. So, all of us will always be wondered by seeing a great movie, and we always watch it and we never think it how that great movie was made. So, for a great movie, the basic thing always remains the concept. Then, how the script is written, then how it is convinced on the screen, then how the impact was given with the background music and the narration. So this makes a great movie, and we can use the same concept to make a great ophthalmic movie. And adding some amount of entertainment will make it a Premier League movie. So my first suggestion is always be prepared. Even before the submission date is there, whenever you're free, just make a movie and keep it. And whenever the concept arises, once your movie is ready, there are so many conferences happening in a year, both virtually now, physically also. You can submit for any of the conferences which are coming. So the best idea is always make a movie when you're free and when you have the concept and keep it ready. We have to always look for the eligibility. Each conference has their own specification. We have to be very much aware of it. Most movies in all the conferences expect us to make about 8 minutes or less. My suggestion is to make a shorter duration. It is better because the attention span is very small. We can add a small script, make a shorter movie, and later if we want we can enlarge it. Financial disclosure is very important. English narration, either we can give ourselves or we can ask any of a friend who has got a very nice voice, or we can even hire a professional. The first movie is one of the resident who
Glaucoma surgery has seen significant innovations over the past 2 decades in the form of modifications to penetrating.
so this was the voice taken up by one of the American resident who visited our institute, and this we hired a professional to give the voice. So it depends on what is your preference. The main idea is the narration should be clear and crisp so that the audience understands. Next, we have to know the judging criteria. Usually, what are the factors they consider when they are judging it? The applicability and education values remains the basic. Then it should be original. Then scientific content. What is scientific content? What is it validated at this present point of time? How clarity is the picture? Cinematic quality and artistic effect. So in the application education value, we can make movies on innovations. It can be technique, device, or system, the quality teaching, history and review of literature, interesting cases, and complications. So this all can make a nice movie. The first movie is based on a technique of XNet, which also won an award. The second was a device, which is a virtual reality based perimeter, and this a system. A system is family screening. How do we do a family screening in our institute? So these are all award winning movie. It is how we make the concept and how it is applicable. Next, this is one of the movie which won an award in ACRS. This is on what are the tips for the beginners, how to do trabeculotomy. So by giving 3 simple tips, the quality of the video was so good and the narration was so good, it won an award in ACRS last year. Then this was in history and review of literature, just various uses of fluorescent. So just by demonstrating what are the uses of fluorescent, which all of us know, but the nice demonstration also won an award in ACRS. Then we have to keep concentration on audio editing and technical part. Just we make a movie and we don't work on this technical part, that can become a major barrier for the movie. As in this movie,
COVID-19 pandemic has become a major hindrance factor in the treatment module.
as we hear that the background voice is so much that the narration is hidden. So we have to be very clear that what we want to convey to the audience. The audio should be clear, the background music should be very minimal.
COVID-19
Then we can use various artistic effects. We can use infographics.
We did a prospective film on visual experience randomized into 2 groups.
A study which is shown as an infographic will convince the audience better.
Saline, following which they undergo the surgery with intraoperative vital signs monitoring.
And we have to make sure that when we are shooting the movie, the lighting should be adequate. Like when we shot with our smartphone, the brightness will keep on adjusting. So we have to be very sure that our brightness should be fixed, and should have adequate lighting so that we can appreciate the contrast. Then we can use various animation. It can be 3D animations or it can be 2D animations. and we can use various effects. So what makes a good video recording? We have to make sure that it should be clear, it should not be focused out, and it should not be decentered. Here the prime interest is taking a trabecular flap, but it is decentered. All these other things are seen at the center. So we have to make sure that it should be well centered. And we should adjust the brightness. It should not be too bright so that the audience doesn't appreciate what we want to tell. It should be well centered like it is shown in this picture, and it should be clear, and it should convey what we want to tell to the audience or the judges. So the best way for that is, when we are doing a surgical video recording, we'll be more concentrated on doing surgery properly. So it's better to have a TV monitor towards the foot end of the patient. A assistant can see the TV well, or we can have a dedicated assistant to keep watching whether it is centered, focused or properly, so that we can have a good proper video recording. Then we should get used to our foot pedal. So whenever there is a little decentration, we have to adjust it accordingly. And we have to always show the area of interest in the center. So in this movie, we just wanted to show how you do a vectis delivery of the nucleus. We know if it is in a large zoomed view, we cannot see the vectis insertion delivery of the nucleus. So what we should do is, we should come out like lesser the zoom, then we can show how the vectis is inserted and how the nucleus is delivered. So that should be our primary area of interest, and we have to adjust accordingly. Here in this, just how do we prolapse the nucleus? By doing this rotational action. So we have to focus the center properly. So avoid non-essentials, like when we are doing a trabeculectomy or SACS, whatever it is, the parameters on the phaco machine is not important. So we don't have to show all those parameters. We can just take off those parameters so that the audience or the judges don't get diverted for these unnecessary things. So the best way is to take off this overlay which is connected to the machine. So we have to understand our camera settings. We should know how to adjust the white balance, how to adjust the brightness, and always we should check the output file. So nowadays we all see the widescreen. So better to have a 16:9 compared to 4:3. Better to get with the full resolution, like full HD 1920 by 1080p, so that we can reduce the file resolution later to decrease the size of the file. We should always record in the best resolution. And always we should showcase our best video recordings. So in conclusion, we should have a good concept, convincing screenplay, good narration, suitable background music, add minimal but suitable masala that makes a recipe for an award-winning movie. Thank you.